Welcome to The Explainer. Today, we're digging into a really surprising paradox. What if the very system we built to save our lives was actually helping to create a global crisis that threatens all of us? It's a huge, ironic twist at the very heart of modern medicine. And, this isn't just some what-if scenario. Nope. This is a real, super pressing dilemma that researchers and healthcare professionals are staring down every single day. Okay, get this. If you took the entire global healthcare sector and treated it like a single country, it would be the fifth largest greenhouse gas emitter on the entire planet. Let that sink in. The fifth. That is just a staggering number, and it forces us to look at a really uncomfortable truth. Our system of healing has a pretty serious hidden problem. And just to put that into perspective for you, healthcare's carbon footprint is actually larger than the aviation and maritime shipping industries combined. Yeah, you heard that right. We're talking all the planes in the sky and all the cargo ships on the ocean. So this isn't some small side issue. It is a massive, system-wide problem that we've got to pay attention to. And this is where things get really tricky. Researchers have a term for it, a bi-directional challenge. It sounds a bit clinical, but what it really means is a dangerous feedback loop, a vicious cycle. Think about it. A hotter planet makes more of us sick, and then the healthcare we need to get better ends up making the planet even hotter. It's a snake eating its own tail. All right, so how does this vicious cycle actually work? Let's break it down. First up, let's look at the part of the story we're all, unfortunately, becoming way too familiar with, how climate change is directly impacting our health. Okay, this really lays out the devastating domino effect we're caught in. It's a four-step trap. Step 1, more climate-related disasters. Step 2, that causes more physical and mental harm to people. Step 3, naturally, that drives up the demand for healthcare services. And finally, Step 4, that increased demand for care pumps out more greenhouse gas emissions, which, you guessed it, just fuels the very crisis that started the whole thing. It's a perfect, terrible loop. And when we talk about health impacts, the scope is just huge. We're not just talking about, say, an injury during a flood. We're talking about climate change making chronic conditions like asthma and heart disease worse. We're seeing infectious diseases spread to places they've never been before. And of course, there's the massive, and I mean massive, toll it's taking on our mental health. It really affects everything. But that's only half the story. Now we're going to flip to the other side of this cycle, and this is the part that, honestly, is probably the most surprising. We're talking about the hidden environmental cost of the very care that's supposed to make us well. So, that number, 4.4%, that is healthcare's share of all global greenhouse gas emissions. And again, for context, remember how we talked about aviation? The entire airline industry is responsible for about 2.5%. So yeah, our hospitals and clinics are actually out-polluting our airports. It's pretty wild when you think about it that way. So the big question is, where is all this stuff coming from? You might picture a big smokestack on top of a hospital, but it's way more complex than that. Healthcare's carbon footprint is woven into literally every single part of the system. Just think about the last time you went to the doctor. The electricity for the lights, all the single-use gloves and masks, the energy it took to make your prescription, it all adds up, big time. Okay, so experts break these emissions down into 3 categories or scopes. Scope 1, that's the direct stuff, like emissions from a hospital's own boilers. Scope 2 is indirect. It's the energy the hospital buys to keep the lights and equipment running. But here's the kicker. Scope 3. This is the big one. It's basically everything else in the supply chain. We're talking about manufacturing pharmaceuticals, medical devices, transporting food. It is, by far, the largest chunk of the problem. So, okay, this is a pretty daunting problem, right? But the good news is, it's not hopeless. Far from it. In fact, researchers are already on the case. A team at the Australian Institute of Health Innovation is pioneering some really smart ways to break this vicious cycle. And their big initiative is called the Observatory on the Future of Healthcare, or OFH. And their mission is simple but super ambitious. Use evidence, use hard data to figure out how to build a healthcare system that's both low carbon and resilient enough to handle what's coming. And what I think is so cool about their work is how they connect the problems directly to the solutions. You can see it right here. The challenge? Wasteful care. The solution? Something called the 60-30-10 challenge to find and get rid of low-value treatments. The challenge? The system isn't prepared for crises. The solution? Build a learning health system that can adapt on the fly. It's all about creating these concrete, data-driven frameworks. And this really gets to the heart of it. This isn't a problem that just a few smart people in a lab can solve. The research is clear. It's going to take everyone. We're talking every single healthcare professional, every manager, every policymaker, and yes, even every patient has a role to play here. It's a total system-wide effort. Okay, so what does this all add up to? What does a resilient, sustainable, future-proof healthcare system actually look like? Let's paint a picture. Well, a huge piece of the puzzle is tackling what's known as low-value care. Get this, on average, about 30% of all healthcare is considered waste. We're talking about stuff that provides zero benefit to the patient. So by cutting that out, we not only slash emissions, but we also improve the quality of care. It's a total win-win. And it's also about making smarter choices, like using greener and aesthetic gases, decarbonizing our buildings with renewable energy, and making sure our frontline workers are trained and ready for the health impacts of climate change.
Ultimately, the goal is to transform healthcare from being part of the problem into being a massive part of the solution. We want a system that isn't just resilient and adaptable, but one that's an active partner in creating a sustainable world.
And that leaves us with one final big question. For all of modern history, healthcare was designed with one simple goal: cure us. But can we now redesign it to help cure the planet too?